This is Safi. She's a 16-year working Cocker Spaniel. In the walk, we notice that her elbows are twisted laterally. She also crabs to the left and is very base-wide behind. She circumducts both her hind limbs, and she has a short stride length and a short protraction phase, and she doesn't track up.
We also saw that there's very little motion or movement through the hips and stifle, also through quite a lot of her joints. She's quite stilted in her movement. There's also very low flight arcs, especially behind, and the handler did notice some toe dragging at some points. We also saw there's some hyperextension of the carpal joints. And then going into trot as well, all of the things that we saw in walk were evident, but also we can see that, again, she's not tracking up. She is more comfortable though, perhaps due to the momentum, and also that she's more used to trotting in her general work than she is in walking. She's still also crabbing to the left.
Given her age as 16 years old, as her owner through discussion with the vet over the years, there have been initial issues in the shoulder area, causing adaptation to movement with the carpals, which now also have issues. And this can be seen in the way she walks and the hyperextension of her carpal joints, and also that she was now further compensating with her elbows, which are now rotated out. Due to her general age-related changes to her joints, there have also been compensations in the hind limb seen with the base-wide carriage and circumduction, a reduction in range of motion and flight arcs with reduced flexion extension of the joints. This is Dee. He is a 10-year-old horse. At the walk, he walks with a slight dorsal excursion of the right pelvis on 3 tracks and holds the pelvis to the left. He has more right barrel swing and is very close behind. When he's circling towards the right, he drags the left hind, and crossover could be slightly better with his inside hind, but he is also worse circling left. The crossover behind is reduced, and the steps are shorter. He rotates on his hind feet and doesn't step over with the inside left hind. When backing up, he's stiff, unwilling, uncoordinated, and takes very small steps in general, especially behind, not using diagonal pairs, and drags all 4 toes. He has low flight arcs and steps heavier with the left hind. There isn't much flexion through his hocks. His right hind circumducts, and there isn't much flexion through all of his joints. He is stilted in general and appears uncomfortable and stiff.
From the lateral view and walk, you can see that Dee's flight arcs are quite low, and he's stepping heavier with his left hind, and there isn't much flexion through his hocks. He circumducts his right hind, and there isn't much flexion in his joints overall, and he's quite stilted in general, and you can see that he's quite uncomfortable and stiff. From a cranial view, he jumps into trot. He has a slight head nod on his left fore, and he steps heavier on his right fore and left hind in diagonal pairs. He walks on 3 tracks and has his pelvis slightly to the right. From a caudal view, you can see a slight dorsal excursion of right aspect of pelvis. There's an intermittent toe drag on his right hind with some hind limb musculature asymmetry. From a lateral view, you can see that the right hind has less protraction. There's a lower flight arc behind, and he doesn't track up. There is little and almost no suspension phase, but he's better at tracking up in trot, and he's generally more forward and uncomfortable with a slight decline rather than an incline.
The uneven and often uncomfortable looking locomotion that we saw in this horse is probably due to orthopaedic or musculoskeletal disorders, although of course we would require veterinary diagnosis to confirm the exact issue. However, we can actually theorise on the possible causes of these abnormalities that we saw. For example, the reduced range of motion that we saw in several of his joints may be affected by several factors, some being pain, joint capsule fibrosis, fascial tissue restriction, musculotendinous tissue adaptive shortening, and osteophytes related to arthritis, and also intra-articular swelling, just to name a few. We thought these issues in this horse may have started in the hind limbs, and we actually observed him to be more cranially loading and was also a lot more comfortable going downhill. So he seems to be shifting his weight onto his forelimbs to take the load off his uncomfortable hind limbs. This in turn may have led to the uncomfortable forelimb movement, with the perhaps slight forelimb left fore lameness due to this overloading. With obviously horses already hold around 60% of their body weight on their forelimbs when standing still, with these figures rising excessively with increasing speed and jumping. These excessive strains to the forelimbs are some of the reasons why forelimb issues, like tendinitis, are so prevalent. Therefore, if this horse is shifting more weight forward, this could eventually predispose him to forelimb issues, perhaps initially as excessive muscular tension, which he probably already has, then to more severe issues such as tendinitis, ligament issues, and hoof problems.